Hey, welcome back, everybody. This is Drew Van Zee, or as some people know me, the knee pain magician. So this week we're going to be working on balance exercises to reduce chronic knee pain. So if you're new here, this channel is for you if you're probably over 50, you used to be really active, but now you're dealing with chronic knee pain, knee stiffness. You may have tried a lot of the common approaches to find relief, possibly cortisone injections, steroids, maybe PRP, possibly stem cell injections as well. You've tried other things like physical therapy, massage, body work, acupuncture, chiropractor. You've worked with your orthopedist and physio, but none of what you've tried has helped you find lasting relief. If so, this channel is for you. So one of the big problems in Western medicine is that they focus too much on where it hurts. Maybe injections in that area, massaging that area, strengthening the muscles around the knee. If that's helped, awesome, right? The simplest things sometimes can be the best solution. But if not, it's probably an indication that there's something going on elsewhere in your body that you haven't yet been able to identify that are the underlying or the root causes of your problem. So in my 9 years of experience helping myself and many other people dealing with chronic pain, especially if you're over 50, 60 years of age, one of the things that is the underlying contributor to pain and stiffness is a balance issue. So why am I pointing to my head? Well, I'm actually pointing to my inner ear, because your vestibular system, or your inner ear, is where most of your balance comes from. So maybe you're thinking that, well, I haven't had a balance problem before. I haven't tripped. I haven't fallen. So why would that be something that I need to work on to reduce my knee pain? Well, your brain primarily relies on three things to help you feel and move better. Number one, it is proprioception. That's the ability for you to move your body. So having good ability to control your knee, control your ankle, move your body, that's one system. It's called proprioception. Second most important system is called your inner ear, or vestibular system. So your inner ear is like your personal GPS, because it tells your brain where you are in space. So here's a good analogy that may help you. So imagine you're on a road trip, right, in a city you haven't been to before, and this is like pre-smartphone. So you have to rely on the old school paper map or printed out Yahoo directions, right? So maybe it's a little bit dark. You're pulling over, you've got to turn the light on. You're looking at your map, looking at your printout, trying to figure out where you're going. But maybe some of the ink didn't print out all that clearly. So you're trying to look at the street name. You can't really figure it out. Maybe it's rainy outside. You're trying to figure out what street you're on. You don't really know. Maybe you're in an unsafe part of town. It's getting late. You got to meet somebody. Naturally, you probably start to develop a little bit of anxiety and get a little bit worried, right? Because you don't know where you are and you don't know where you're going. So when it comes to pain and movement, your body's the same way. The better your brain has an understanding of where you are in the world, where you're going, the more reassured it's going to feel. And the more confidence your brain and your nervous system has about what's happening around you in your environment and what's going on with your body, the less reason it has to send out pain and stiffness to try to slow you down and protect you. So usually Western medicine, we focus on where it hurts. But the reality of pain is that it's actually a lot different than that. Pain's always a protective response to try to slow you down and protect you. So even though you may have knee pain, maybe it's bone on bone, maybe it has arthritis, that doesn't matter as much as you may think. The reality is that there's other systems contributing to the underlying cause of that pain and stiffness. And it can be as simple as developing better balance, which is working your inner ear, which gives your brain more confidence about where you are in space and where you're moving to. So if we can improve your balance, we can help reduce knee pain and knee stiffness. So again, balance consists of essentially three things. We talked earlier about proprioception. That's your ability to move. So your foot and toes, you need to be able to feel the ground. You need to be able to have good mobility within your joints, so your brain and your peripheral nervous system can interact and you can know where you are, where you're going. Um, Vision is also an important part of balance because your eyes are able to kind of help communicate with your brain what's going on around you, which is also playing a role with your proprioceptive system movement. So they're kind of talking with one another, like sending the same signals. So your brain's getting some input from your vision. What's going on around me? Is there a stair? Is there a curb? You're able to feel for that while you're moving. So those are two systems related to balance. The biggest system that has an impact on your balance, where primarily your balance comes from, is your inner ear. That's called your vestibular system. Your inner ear has different canals, and those canals sense directional movement, whether you're moving forward, moving to the side, or you're moving backwards. So you need to be able to have good movement in all of these different directions so that your brain gets that continued activation and feels like it's really confident in what's going on with your body, where you are in the world. So if you're not new to my channel, you know that the first thing we do before we start an exercise is we start with an assessment. And an assessment is anything that is measurable and important for you to check in with how your body is currently feeling. So a couple different ways to do that. You can think about a pain scale with your knee, pain and stiffness. On a scale of 1 to 10, 10 being really high, you feel terrible, 1 being, hey, you're amazing. So where are you right now? Kind of just scanning your body, so to speak. Maybe you need to do a little movement, paying attention to where you are on that scale. Another great thing is just to simply go for a walk. Take a few steps down, take a few steps back, kind of pay attention. If it's your right knee, how does the right knee feel? Is it really stiff? Is it painful? Do you have a sharp twinge or a deep ache? While you're walking, do you notice that you have some compensation somewhere else in your body? Maybe you're walking with a little bit of a limp. These are some of the things that you need to pay attention to as you're going through this process. So after you do your kind of pain scale and you go for a walk, I want you to try to do some range of motion or some movement assessments. So a couple of different ones that I like to do with people are a simple toe touch. So standing up, bending down, touching your toes. You could do it a few times. See how that feels. You could do a few squats. Standing up, separating your feet nice and wide. If you're able to do it, great. If not, you can always do a different assessment. So I'm bending my knees, my hips go back, kind of putting my hands out like I'm going to catch a ball. And I'm having a nice little rhythm between my knee and my hip bend. So this isn't an exercise. All it is a way for you to assess and for you to check in how your knee or your knees are currently feeling before we do the exercises that should help you. Okay, so this first exercise, it's called VOR, stands for your vestibular ocular reflex. So something that you're designed to do. So what is it? Basically what it is that you're looking at an object that's not moving. In this case, I'm looking at the camera lens on my iPhone. So I'm keeping my eyes on the target, not letting them leave that. And I'm simply going to rotate my head left and rotate my head right. That's all it is. Rotate left, rotate right. So I want to imagine that there's a laser on the tip of my nose. And as I'm rotating, I'm not drawing a squiggly line. I'm not tilting my head, right? I'm drawing a totally horizontal line to the left and a totally horizontal line to the right. So one mistake that people often make, especially if they have a little bit of difficulty with this exercise, is that they start to move their eyes as they move their head. So I move my head left and then my eyes kind of like tend to follow. So that's one thing you want to pay attention to, is your eyes have to stay fixed on the target while you're moving your head simultaneously. So my eyes are on the camera lens, I'm rotating left, rotating right. You could do this about 10 times. Just get this motion down. If you need a different target, you can look at a pen or you can look at your thumb. So here I am looking at my thumb, rotating my head left, right, left, right, left, right. So I want you to make sure that your eyes are focused on the target, that you're doing a straight movement with your head. Sometimes people kind of tilt their head this way, they kind of go like that. So we want to try to be as precise as possible. Better you can move your head and have control over it, the better kind of precise stimulation you're going to have in your inner ear, which will translate to less knee pain and stiffness. So after you feel like you kind of have that movement down, you can add a little bit of speed. So I want you to imagine that inside your inner ear, you have like a little bit of a jello. And if you can imagine like jello on a plate, if you were to shake it, once you stop that shaking, the jello is still going to move a little bit, right? Before it kind of settles. So I want you to think of that in relationship to this exercise. So keeping my eyes on my target, I'm going to do a quick head shake, wait until that jello stabilizes, pause for a second, and then I'm going to do a slow return back to center. Quick head shake, wait for that jello to stabilize, return to center. You could do that to the left. You could do this to the right. Trying to close my mouth unless I have to talk, breathing through my nose. Quick turn, slow return back to center. Quick turn, slow return back to center. Yeah? So one kind of interesting nuance here. When you move your head to your left, you're activating the inner ear on the left side of your body. That is responsible for providing stability on the left side of your body. So if you have left knee pain, moving your head to the left can help reduce pain and stiffness on that side. If you have right knee pain, moving your head to the right can help improve stability and reduce pain and stiffness on that side of the body. So we just worked on two directions, left to right, eyes on the target, making sure that we're not drawing funky lines, but we're being really clean and precise with our movement, breathing through the nose. Once you've done that and you feel comfortable, I want you to move your head up and down. So again, eyes are on the target, moving my head up and down. If you see me from the side, looks like this. The reason why we're doing that movement in addition is because you have canals in your inner ear that sense forward motion and that sense backwards or posterior motion. So oftentimes when you get a little bit older and maybe you're not as active as you were because you've been dealing with this pain and other stuff in your life, you're not getting that same kind of activation with the balancing system. And so your brain wants to have that. It feels more reassured with that info. And so we're just kind of waking that system up, so to speak. So again, you need to have a target that you're looking at. It could be a pencil or your thumb. Here I am looking at my thumb. Going to rotate my head 12 o'clock to 6 o'clock. Once you get that movement down, then you could add a little bit of the speed to try to shake up that jello. Shake it up. Come back to center. Shake it up, come back to center. Do the same thing going down. Quick head turn, back to center. Quick head turn, back to center. So those are 4 different directions we worked on, left to right, top to bottom. I want you to focus on breathing, relaxing your body, making sure that you're kind of moving in a clear, precise direction each way. If that feels good and you feel like you've got good control over it, I want you to add a little bit of speed. Thinking about that jello analogy, doing a quick head turn in one of those 4 positions, holding it, pausing for just a moment before you return back to center to complete kind of those 5 reps. So that's called your VOR. And if I could give you one exercise to improve your stability, to improve your balance, which is also going to translate into improved knee function, this is it. It's called VOR. Give that a shot. And Afterwards, I want you to go and assess, go for your walk and try your squats, see how your knee feels, and we'll move on to the next exercise. Okay, this next exercise is quite different. And so what it works is actually something called your otolith organ. So your otolith organ is responsible for telling your brain if you're moving up and down, kind of like if you're in an elevator. And it's also responsible for kind of this lateral motion, side to side. So an interesting thing I found this past year working with older people over 50 struggling with knee pain is that this one exercise in particular can provide some immediate relief. So I'm going to show you how to do it. So what you're going to do is stand up nice and tall, separate your feet nice and wide, and you need to have some kind of visual target. So it's got to be a target that's not moving, so it's not going to be your dog or your cat at home. So I want you to look at like, either a point that you put, a Post-it note that you maybe put on the wall, or some small kind of point of reference that's not going to move. So once you kind of have that visual target and you're standing up nice and tall, your feet are wide, what you're going to do is you're going to you're going to move your body side to side, just like this. So I want you to pay attention to the elevation of my head as I'm doing this motion. So I'm not going up and then down, and then up and then down. It's very linear, side to side. I'm moving to my left, moving to the right. Again, it's kind of like that laser idea. You've got a laser on the tip of your nose, and it's drawing a straight line left to right, left to right. In order to do this, I got to bend my knees. So if that's uncomfortable for you, just kind of rub your knees first. Helps give your brain a little bit more confidence with them before you do some more movement. So again, nice and tall, separating your legs, and it's kind of like you're doing lateral lunges, side to side, but you're keeping your eyes on that target while you're moving. So I'm going to rotate so you can see what my knees look like from this position. So here I am nice and wide. I've got my target, and I'm just going to shift my body side to side, making sure I'm avoiding kind of these big noticeable up and down movements. And I'm trying to be as clean in this lateral movement, keeping the same elevation side to side. So that exercise is super simple, but it stimulates a part of the inner ear that you probably don't activate and move enough. So again, when it comes to pain, it's all about improving the brain-body connection. So if there's an area of your body that is important and your brain feels like, well, that area is kind of dormant, it's disconnected, the brain doesn't really know what's going on there, doesn't feel like it's in control, then your brain can send out pain and stiffness in your knee because it feels like it's vulnerable. So the pain and stiffness is just a way to communicate with you that it doesn't feel confident moving. So if we can improve the inner ear function, your brain's going to feel safer about what's going on with your body, where you're moving, and your knees are going to feel better. So give that exercise a shot and then go and reassess, go for your walk, try your squats, see how your knee feels now. And then we're going to work on our third exercise. Okay, so now we're going to be working on our third and final exercise. This is something really cool. I like it a lot. It helps my body. It's a little bit more advanced in some ways because it just requires more out of your body. So this is called an infinity walk. And as you can see here, we've got 2 foam rollers, right, where they're kind of like makeshift pillars. So you probably don't have 2 foam rollers at home. That's not a problem. What you could do is you could take 2 shoes or something that is kind of forgivable if you were to hit it with your foot, but something that's also kind of somewhat visually distinct. So your eyes can pay attention to it as you're moving around it. So this exercise kind of integrates multiple different things. For one, you're going to be moving, so that involves your body, proprioceptive system. You're going to be looking at something directly and indirectly. So you've got vision you're focusing on, and then you also have peripheral activation. In addition to that, you're going to be moving your head. So that is inner ear input activation. So you kind of get a triple whammy, so to speak, with this exercise. Again, this is called infinity walk because you're going to be walking in an infinity or figure 8 direction. So if you have grass and you're outside, that's amazing. If not, that's okay. Maybe it's winter where you are, or you kind of have different circumstances. If you have a little bit of a living room, maybe you've got like 5 to 10 feet down your hallway or something like that. Actually, maybe the hallway's not good because you need to have a little width also. Anyways, I'll stop talking so much and demonstrate the exercise. So you've got your 2 foam rollers, your 2 imaginary pillars. Again, you could use 2 shoes if you need to. In addition to that, you've got a visual target. Your eyes are looking at something that is not moving, something relatively small that you could focus on, right? Your eyes need to stay focused on that during the entirety of the exercise. So I'm going to demonstrate the exercise, and so you can watch me. So I want you to see where I'm starting from. I'm going to be looking this way at a target, something on the window, and this is on the outside of my body, right? So I'm on the inside of where the foam roller is in comparison to the target I'm using with my eyes. So I'm not going to be looking at the foam roller directly, but I'm aware of where it is, yeah? And so also you want to pay attention to not hitting the foam roller or the tennis shoe that you have on the ground, trying to avoid it. So keeping my eyes on the target, paying attention to where this is. I'm going to walk around this next foam roller, again, without looking at it directly, keeping my eyes and my head oriented towards the target. Now, coming around the other way, again, paying attention to where this is, but not looking directly, eyes on the target. Another lap. Coming around, back again. I want you to try to do about 10 laps. If that's okay for you, you can add a little bit of speed. Again, the main thing you're trying to do, rotate your body around the shoe, around the foam roller, keeping your eyes focused on the target. And that's the exercise, right? Pretty simple. Depending on kind of the severity of the pain and the stiffness you have going on, that may not be inappropriate exercises to do today. That's okay. If you can do it, great. If not, there's other exercises you could practice on for the time being. So that's kind of level 1. So level 2, I'm just changing this just to make sure you can see me okay. So level 2 is when you are on the outside of the foam roller. Again, so I'm on the outside, foam roller is on the inside, and then my visual target is one step beyond. So now, when I move down, I have to go beyond, and then I have to rotate my body. Again, I'm rotating my body this way so that my eyes can stay on the target. If I rotate my body that way, I'm not going to be able to see the target, and that's a problem. So you're going beyond the foam roller, rotating towards the target, walking around, coming back, doing the same thing. Beyond the foam roller, pivot, come around, same thing. My peripheral vision is picking up where that foam roller is. I'm going beyond it, walking past, breathing. Try up, hit it. So I probably have to do 5 push-ups now. Just kidding. So that's the exercise. Again, right now my knees feel fine. I don't have pain and stiffness there. You may have to change your speed, go a little bit slower. Maybe you have to focus on the first version. And so I hit the foam roller twice going that way. So Pay attention to what's going on with your body while you're doing these things. Small little changes like that are something to pay attention to, and that could be something you want to work on. Okay, so now after you've done your infinity walks, at least have gone through the first version, pretty easy. If that's challenging enough, that's fine. You can stop there. If you want something a little bit more advanced, you can work on that second version. Nevertheless, you have to think about what's the goal of the exercise. The goal of the exercise is for you to keep your eyes on a target. It's for you to be able to move your body without losing sight of the target around two objects, figure 8 fashion. So once you've done that exercise, put the shoes or put the foam rollers to the side and then go reassess. Go for your last walk, maybe go up and down a few stairs. Try your squats. Touch your toes. Pay attention to your pain scale on a 1 to 10. Pay attention to the level of stiffness and pain in your body and overall quality of movement. So if earlier when you went on that first walk, you noticed that, wow, you really had that sharp knee pain. You also were walking with a limp and you felt like, you were dragging your shoulder or something. That's kind of like a gross understanding of how the body was moving at that point in time. Now go back again to the walk and see how are you feeling now. If these are the right exercises for you, you're going to have less pain. You're not going to be walking with as much of a pronounced limp. You're going to feel a little bit lighter on your feet. So your nervous system is kind of like a light switch. If we give your brain and your nervous system the right things, it's kind of like the light switch goes on. And when your brain gets what it wants, you're going to have less stiffness, less pain, more range of motion, and more strength, right? Everything just gets easier. If you're giving your brain and your nervous system the wrong activation, or it can't handle it for whatever reason, you're going to have the opposite of that. You're going to have more stiffness, less pain, less strength. Overall, your athletic ability is going to be less, right? So that's why we're assessing before and after we're doing these different exercises to make sure that what you're doing with your body is giving you the result you want. Otherwise, who knows what's going on, right? So we want to try to focus on what's going to help you for your specific needs. Okay, so that's our video for the week, focusing on improving balance skills, getting that inner ear activated so that your brain feels more comfortable moving where you are in the world so that it can stop sending out so much pain and stiffness to your knees. So again, one of the common mistakes that I see people make when they're trying to get help with their knee pain is that they are hyper-focused on where it hurts, massaging it, cupping it, strengthening it. However, pain works a lot different than what we've been told. And the reality is, if you improve the overall brain-body connection, and one of the great ways to do that is by improving your balancing system, your inner ear, you're going to have less pain and stiffness because your brain feels more confident with your body. Again, the knee pain is related to the brain-body connection, and the better your brain feels connected and in alignment with your body, the better your knee is going to feel and move. So today we worked on 3 separate exercises to stimulate different parts of your inner ear, giving your brain more awareness of where you're moving, the quality of your movement, giving your brain more awareness of where you are in the world, where you're moving in space. The exercises were VOR. We worked on that lateral motion, and then we also worked on infinity walks. So 3 fun, different exercises. You likely haven't tried it all before. After you do each exercise, go and assess to see how your body's feeling. And if you're feeling a change from the exercise, you've got less pain, less stiffness, great, that's awesome. Keep doing that. Try to do it a few times a day throughout the week until we put out next week's video. And drop a comment in the comment section. How are you feeling? What was your experience? It's fun for me to see and then for everybody else as well. Okay, so that's it for this week's video. I always appreciate your support. If you could click the like button below and subscribe to my channel, that would be amazing. And in addition to that, if you're someone who's really been struggling with a lot of chronic aches and pains in your knee for quite some time, maybe you've tried lots of different things, it's been able to provide a little bit of relief, but not lasting change, and you're someone who's really interested in getting back to the activity that you used to do, I have something else for you. So if that's you, I have a free webinar. It's a great training that gives you a better understanding of what this perspective and approach is, the brain-body connection, how it can help alleviate and provide a solution to that long-lasting chronic knee pain you've been dealing with. So if you're interested in that, I encourage you to check it out. It's at the bottom, or there's a link at the bottom of this video in addition to my homepage. So be sure to check that out and talk to you soon. Okay, bye-bye.